So welcome everyone. It is my pleasure to see all of you to another webinar of our technical webinar series on climate change and house. My name is Yiqi Pan. I'm a technical officer in the climate change and house unit at WHO. And today we're going to talk about climate resilient and environmentally sustainable healthcare facilities. And as you can see on the slide here, we're gonna hold the session twice. One in the morning, the one you're visiting right now, and one in the afternoon. So just to kindly note that the content for both of these sessions will be very similar. So these are not consecutive sessions, so there's no need to take part in both if you've already joined us for the AM session. But we will have different country examples. So if you're interested in that, it is definitely worthwhile to tune in for both. This is an overview of our technical webinar series, probably familiar to most if you have already visited one of our webinars. As you can see here, we're halfway, and so we have already done a couple of webinars, and there's also more webinars coming up. If you're interested in visiting any of those, be it the upcoming ones or the ones that we have already conducted, you are very welcome to scan our QR code here or to visit our website, and you can access all the recordings of our previous webinars, and you can also register for our upcoming ones. We have interpretation today for this session. So for this session now in the morning, we have interpretation in English, French, and Arabic. So you can go to your Zoom and find the interpretation button. Sometimes it is under those three dots under more. You can click on the interpretation and choose the language you are most familiar with. And also just a couple notes on housekeeping as always. So we've set up this webinar, not as a webinar, but as a meeting to facilitate discussion and communications. So you have the option to unmute yourself and turn on your camera. But we would kindly like to ask you to keep yourself muted if you're not speaking, just so to minimize background sounds. So, okay, then we move forward to the agenda. We're obviously here at Welcome Housekeeping, and in a second, I'll hand over to my colleague, Dr. Amy Savage, who's a technical officer in the Climate Change and House Unit at WHO. And then I have the pleasure to welcome my colleague from WHO Eastern Mediterranean Regional Office, Mr. Saleh Rababa, to do the technical presentation on climate resilient and environmentally sustainable healthcare facilities. This is then followed by country experiences. So we have the pleasure, and we're very humbled to today have Dr. Jafar Jandagi from the Ministry of Health and Medical Education from Iran with us today to provide an overview of his country's experience in implementing climate resilient, environmentally sustainable healthcare facilities. And then we have the pleasure to welcome Dr. Cuong from the Ministry of Health Vietnam to also provide us with the journey in Vietnam. Then we have an interactive group activities. Those who have already visited our webinars may be familiar with that. We're gonna have smaller breakout rooms just to facilitate discussions. Then we come back in the plenary to talk about what we have discussed in the breakout rooms before we come to the close. Okay, then with that, I would like to hand over to Dr. Amy Savage.
Thanks so much, Yiqi. I'm really pleased to make some very brief remarks just to kick off this webinar today. So many of you will have already joined us for our other webinars in this series, and you'll know that here in WHO, we really do place a high importance on this technical series to support climate change and health work across the globe. We have been working for several decades on highlighting the risk of climate change to health and developing a comprehensive support package to address the risks, and these webinars just form a small part of that. You probably also know that the work on climate change and health has really been elevated even more over the recent months. We had our first resolution on climate change and health in 16 years, adopted at the WHA earlier this May. And also at the WHO's new General Program of Work was approved, and it includes climate change as one of the 6 top strategic level priorities. So the importance of this work to protect people's health from climate change is very clear for WHO, for our member states, and for the global health community. And we can see that it is only really increasing in importance. So over the last few months in this webinar series, we've looked at understanding what are the health risks of climate change in your countries by conducting a vulnerability and adaptation assessment, and then developing a plan, a health national adaptation plan to address those risks and build a climate resilient health system using WHO's operational framework. And what we really have tried to emphasize with these webinars is that they're also grounded in country experiences, and we're really just as interested in hearing from you as we hope that you are from us. So today we'll follow on from those previous webinars and look at some interventions for implementation of those plans. So particularly today, we're looking at building climate resilient and environmentally sustainable healthcare facilities. Healthcare facilities are, of course, critical, and we often say that they're the first line of defense against climate change. So drawing on all our years of experience in climate change and health and piloting this work in many countries, in 2020, WHO published its guidance for climate resilient and environmentally sustainable healthcare facilities. And then in 2021, we published a checklist to assess the vulnerabilities of healthcare facilities in relation to climate hazards. Healthcare facilities are, of course, exposed to climate hazards, which can result in reduced quality of care. And at the same time, healthcare facilities generate environmental impacts and contribute to greenhouse gas emissions. So the WHO guidance, it really aims to provide practical tools and examples of interventions for ensuring safe and quality care, even when we're facing these effects and impacts of climate change. But again, we really look forward to hearing the country experiences that will be presented today. And we want to hear from all of you and your experiences in the breakout rooms, talking about improving the climate resilience or reducing the environmental impact of your healthcare facilities. So with that, I'm really pleased to hand over to my colleague Saleh Rababa from the Eastern Mediterranean Regional Office to walk you through the WHO guidance and approach. Thank you.
Thank you so much, Amy and Yiqi, for handing over and for having me and inviting me to present on this very interesting topic. So let me share my slides, my sample slides, just really quick. And I hope now you can see them.
Yes.
Yeah, perfect. So good morning or good afternoon from wherever you're connected with us. And as mentioned and introduced by Yiqi and Amy, I'm Saleh Rababa. I'm a consultant on climate change and health in the regional office for the Eastern Mediterranean region, WHO. I'm very glad to be connected again today as a speaker and previous webinars as one of you, one of the attendees. A very interesting series of webinar, a very interesting topics, and very glad to see that the numbers are raising webinar after one, which indicates good news or tells the good news for us that the interest is there. Everyone is willing to know more, and perhaps now will take you to further steps to do more. That's what exactly we want. So previous webinars took you along in a journey of V&A assessment, introducing climate change and health and relations, how to do the assessment, how to build your adaptation plans on finance, on GIS. So all of these are interconnected into a bigger umbrella of working on the health system itself, big talks of adaptation planning, strategies, assessments. And now we continue to dive more into another level also, another area of work within a very important area, and I think very integral part of the health system, the healthcare facility. So I will be going through slides. You will have the slides after the webinar. There will be the recording. So don't mind the slides very much. Just let's talk it more and discuss it more. So as mentioned by Amy, now I think once you're here, you're interested. Once you are attending the webinar, or you already know that climate change is affecting health, and it's affecting health in many and various ways. I think now everyone is talking about this, and I think and I believe that climate change will be affecting not only the listed ones that you see, this very famous, I think, graph or picture or whatever. I think you saw it in many previous webinars, but I think it is, and it will be affecting and touching many other health outcomes, many other aspects within your life and within our life, and more importantly, also will be affecting the health facilities itself. Not only the health facility itself as a building or as an operation or as services, but also the load that is being put on the health services. Once the climate change is affecting many health outcomes, many aspects of social and health outcomes, it will bear more load and more pressure on the health services. So it's layer over layer, pressure over direct effect over the normative services that the healthcare facilities are providing. So it will be a lot of pressure on healthcare facilities themselves. And as Amy mentioned, they are the first line, and I will add, and the last line of defense in face of any climatic crisis or any effect of climate change on health. Because eventually you want a well-running and functioning healthcare facility to take care of the people who are affected by flood or by storm or by a heat wave. So you need to make sure that your healthcare facilities are well prepared, weaponized, and resilient in terms of any thing that will be happening due to climate change or climate variability and weather conditions. So this is the main idea that we're talking about, and you see that many factors are contributing, many factors are interacting, but eventually I think this all will be falling on the shoulders of the healthcare facilities and the staff working in the healthcare facility. These are real photos, and only from two countries, from one region, which is our region. And you can see how only also one climatic hazard or crisis, the floods, have done to a healthcare facility. And I'm sure no one of us will be willing to be treated or to be taken care of in a healthcare facility that is suffering such conditions. So it's very important to take care of the healthcare facilities to enable them to take care of us, and we need to do it now. We're not talking about something that will be coming. It is happening, and we've seen this in many countries. So, okay, I think one might say that we are with you and we believe you, and we want to do whatever you're suggesting, because we believe in the idea of having a good healthcare facility that is resilient and able to withstand any issue, any climatic hazard or any climatic crisis. So what exactly do you mean, or what do you want us to do? This is the main question, or the most important question. Looking at this figure, just to have an idea of what exactly do we mean and what exactly are we looking when we're saying that we want a resilient healthcare facility, or what is resilient healthcare facilities. The graph might look a little bit complicated, or what exactly all of these lines meaning, but it's fairly simple. Just bear with me and imagine this. on the case of COVID-19, for instance. See this flat line here. This is a normal healthcare facility operating under normal or normative conditions, providing services to whatever community it's serving. And this is on the left hand is its capacity. You know, each healthcare facility has its own capacity in terms of beds, staff, specialties, services providing, whatever. But it's normal. And right here on the shock, imagine this is the COVID-19, for instance, or a flood, or whatever emergency you're facing, or whatever shock, or whatever sudden thing that happened affecting the community that the healthcare facility is serving. And now you're receiving more cases, you're receiving more people seeking care from the healthcare facility. Now, how the healthcare facility will be behaving or responding, or on what scale it will be able to move on with these sudden pressure or sudden changes in the normative services it's providing, will depend on how prepared the healthcare facility, on how resilient the healthcare facility in general, for instance, and for specific scenarios that we are expecting. We know, for instance, that healthcare facility is prone to floods. The area is prone to floods. So you should be prepared, or at least you should have an idea. If you're prepared, this will determine the future, let's say, of the healthcare facility and the services it's providing. So it will be perfectly normal that the level of healthcare facility will, at the beginning, starting to drop, because we're human, and when we face a little bit pressure, we will just be pushed back a little bit, just trying to respond. We're still in the response stage. But if I'm prepared, if I have a decent level of resilience, I already put some effort in preparing the healthcare facility and make it more resilient to whatever emergency or whatever crisis is there, I will be able to recover back, you know, going back again, the line is going up again. I will be responding very well, trying to let's say control the damage, keep providing the basic services, keep providing healthcare to the community, and then recover back to the normal, my normal way of working, my normal quality of care, my normal services. And even better, after that, I will be learning, I will be having feedback from that experience, recovering better than before, and why not to transform into another level of healthcare quality. So this is what we actually want. We want to increase our preparedness and resilience, the adaptive capacity to whatever we are expecting, or to whatever the context is saying. Whatever you will be facing in that specific area, in order to not collapse. And we've seen it in many health systems, in many healthcare facilities. For instance, during COVID, they collapsed under pressure. They couldn't cope with the load that was put on the healthcare facility and the health system itself. We don't want to collapse. We don't want also another pandemic to tell us that we need to be prepared in order not to collapse. So we need to act from now in order to increase our preparedness and resilience. So this is the main idea. We want a healthcare facility that is able to anticipate, expect what is coming, prepare to it in order to be able to respond, in order to cope with it, in order to recover from whatever is coming, and then transform into a better place. So this is the main idea about resilience. I know I may spend much time on that slide, but this is the main idea that we're talking about. Other slides, we can go through them, and even you can go through them by your own, fairly simple, especially about the tools. So this is in terms of climate resilience and sustainability in one way or another. On the other hand, also the footprint, the sustainability of the health system and facility itself, the emissions that are coming from the healthcare facility. You don't want to have a mission or your main goal of protecting the health of your community while you are contributing negatively to the environment and community you're living. It doesn't make sense to have two contradicting objectives or way of working. So you're protecting the health, you should be protecting the health in all of your aspects. So it would be just the perfect scenario that the healthcare facility itself, that protecting the community, is not contributing negatively to the community by producing emissions, carbon emissions. This is the other area of work at the healthcare facility that is being promoted, is to lower the emissions of the healthcare facility, different types of emissions. And this is another also topic that you can go in depth with to try to discover where your emissions are coming from. What are the sectors within the health system, within the healthcare facility itself? What operations are producing emissions? Is it the energy that I'm using? It's the fuel? Is it the supply chain, my consumables, my travels, my transportation? And try to identify where are the hotspots, from which scope, what can I do, how to lower them, what practices I could implement in order to lower my emissions. My ultimate goal would be to reach here, this very tiny green corner where I have a low emissions coming out from the health care facility itself, while I have a very high performance, very high quality of health services provided to our community by being more resilient and adaptive to any case that will keep me going on in a good way, having a high quality performance under any climatic condition. And many pathways depending where you are at. Some health facilities, health systems have a good high quality while having a very high emissions. So you need to go from 5 this way to lowering. You need to put more focus on lowering emissions. Some healthcare facilities need to work more, on the quality of care, being more adaptive, more resilience, enhance your operation and services in a sustainable way in order to go up to in the scale into a very high or a good quality of care, while not having very high emissions, or while not contributing, incrementally into your emissions. And this is, again, under a very big umbrella of health system. As we, if you attended the previous webinars, we're not away, and we're not creating a parallel universe or a parallel work of what we already are under. So when we're talking about resilient and sustainable health system, the healthcare facilities are a big part, integral part of that. You're doing an assessment. You're also applying that to the healthcare facilities. You're doing an adaptation plan, or you're enhancing resilience and adaptation of the health system. You're also doing that on the level of healthcare facility. You're assessing your carbon emissions or your emissions. You're lowering the emissions. You're also doing that on the healthcare facility level. So as you saw if you're familiar with the framework, so this is what exactly we mean. It's one part of the healthcare system, is to have a facility that is resilient and sustainable with low emissions. And within the facility itself, we're talking about many aspects within the facility. Either we're talking about the workforce in the facility, the energy used in the facility, the infrastructure, the way the facility is running, is designed, is built, the technologies, the product, the supply chain within the facility, the wash and waste management in the facility itself, which is very important, but also contributing to both resilience and adaptive capacity and the emission and let's say the carbon emissions within the facilities. You need to hit all of these components in order to have a facility that is able or resilient, or to say that the facility is resilient. So we're here to help you achieve that. And this is might be the answer to the question is what to do, what exactly you want us to do. So to help you addressing this question and to actually discuss what you can do, this guidance came out to light with the main goal of increasing the resilience of the healthcare facility to protect and improve the health of the communities that the facilities are serving in the context of a changing climate, in the context of the climatic hazards and risks are there, while at the same time looking into the sustainability to optimize the use of what you already have, or to introduce some things that are, or introduce solutions or interventions that will be optimizing your resources and putting you on a track toward the sustainable operation and services, while minimizing any negative impact to the environment by waste, emissions, and other things. How this guidance is working, fairly simple. We'll go through it very quickly. It mainly looks into the four main components we've mentioned: the workforce, the waste, the wash aspects, the energy aspects, the infrastructure, technologies, and products within the healthcare facilities, guiding you, advising you, giving you recommendations and let's say interventions that will increase the resilience, the adaptive capacity, the environmental sustainability of the healthcare facility. Eventually, we want the healthcare facility to be able to anticipate, respond, cope with, recover back from stresses and from any climatic hazard. As mentioned, it comes in terms of interventions. These interventions are mainly on the four main components, looking into climate resilience and environmental sustainability aspects. One advice would be, before going into the interventions, is to go through them fairly quickly. They will come in the form of these tables, and you can see that on each component there are many interventions, many recommendations that can put you on a track to increase resilience, from having plans, from advising on what healthcare workers could do, trainings you need, the systems in use, the products, the energy part, the waste, the wash, whatever. You might feel that these are a lot to do. These a long list of interventions that I should apply, and this is the main point that we want to point out, that these are not per se interventions. You can adapt whatever you need from these checklists. I know implementing all of these will require a ton of money, a lot of work, a lot of time, and it would be an ideal world. So don't stress too much about what exactly should I do if I can't do this, or if that is not applicable within the healthcare facility or in my context, or I don't need that, or I already have another form of that or another way of doing that. It's okay. It's for you. The guidance, the interventions are all designed with a space, or a room for flexibility, adaptation, and let's say creativity, even for you to adapt, to change, get rid of that intervention if it is not in your context. Change that, add to that. I would love to see what can be changed in one context different than the other. Of course, this is the main idea of having these checklists and interventions. It's not written in stone. It's not something that you should follow letter by letter or word by word. It's something for you to guide you. So also you can guide us in changing these, or in adapting these, or in knowing whatever works for you best, so you can change it in the way you feel that is working better for you. So this is just an example of the interventions on the health workforce for the resilience part of the document, with a long list also for other areas like energy, on the climate resilience, and on the sustainability. Like this, you can also find on the wash infrastructure and etc. So you might say that, okay, I will go to the healthcare facility, try to implement whatever I can on within that healthcare facility to increase the resilience. But I think you and us also might miss one step, or let's say we might need to get back to one step. Is that okay? Before I implement anything, I want to know what exactly is there and what is the situation of the healthcare facility itself. What are the risks? What are the vulnerabilities there? What exactly the health workforce need to be implemented? What areas of weakness is there within the healthcare facility? Energy, for instance. Another complementary tool or another complementary document was created for that purpose, for you to understand the baseline, which is, I think, fairly logical thing, is that before implementing anything, I want also to know what exactly is threatening the healthcare facility, how the healthcare facility is vulnerable to floods, how healthcare facility is vulnerable to heat, to wildfires, to storms, to droughts, in order to optimize the interventions in that I've just presented. So this checklist will help you to do that. Will help you to understand what are the vulnerabilities within your healthcare facility, in terms of the context itself, in terms of any climate, 7 different climatic crises, floods, storms, etc. You will find it all in very elegant, detailed way in the checklist. And as I mentioned, it was complementary to the previous one, to the guidance where all of the interventions are there, to help you just to understand the baseline. Where are you at in terms of if a flood comes, how it will be affecting the healthcare facility, what vulnerable areas are there, what impacts could be put on the healthcare facility itself. So you can do this in parallel. You can do this, before deciding any interventions you will be taking from the first document to implement it. And it comes within the same logic, with a similar structure. You have so many questions in terms of a checklist that you can apply. You can pick from these. As again, one good advice would be to go through the questions, to go through the checklist itself, and try to adapt it, to take whatever you need from it, change whatever you need, add to it, adapt it to your own context. You might take 1 or 2 climatic hazards that are relative to your context. You might add another hazards. For instance, I wish to see in a context where dust storms are hazards, what questions could be asked, or what checklist can be created to that, to assess the vulnerabilities and the impacts. And this is how the tool or the checklist works. Different questions, you can go to the healthcare facility, try to answer it, to see is it vulnerable or not, to determine the vulnerability of the health workforce. Is it high, low, or medium, which means a low risk of that happening, or you are not prepared, or you have some sort of preparedness, or you're totally unprepared and it's a very high risk of happening. So you need to maybe prioritize this and to take action based on that. And also the impact itself. What impact could be happening if that flood or if that heat wave hit that healthcare facility, in order also to put your action points to let's say defeat, or to try to have less impact or less negative impact from that crisis or from that scenario. And this exactly will help you in determining the baseline. You will have an idea of vulnerabilities. You will have an idea about what impacts are there. Then you will go define your priorities based on these vulnerabilities, based on what areas you need more to implement using the guidance we mentioned, the list of interventions we mentioned, other useful documents that been presented in other webinars, and then you will actually implement. And I know it will be a long journey, but a lot of interventions in both documents are win-win situations, so you can implement these, and everyone will be happy, and it will benefit both resilience and environmental sustainability part. And also for the monitoring, will be also with you along the journey. A lot of document, a lot of guidelines, a lot of tools are there to help you to monitor also and to evaluate what you're implementing, how you're doing, the level of effectiveness that is being achieved. And before just handing back to Yiqi, so you might think, or you might see that it might be complicated, and it is the case that sometimes managing something that is complicated could be a little bit complicated, but step by step, by establishing your baseline, defining what you will be doing, choosing the relevant and the needed interventions from different guidances or from different tools, applying them one by one, by priority, by effectiveness, evaluating and monitoring, changing whatever you feel is not working is the way to do it. Eventually, what you're looking for is having a healthcare facility that simply can provide care, can provide good quality services to whoever is in need under any climatic condition, because this is the main mission and the main objective of having a healthcare facility. Otherwise, healthcare facility would be seeking care or maybe healthcare from other departments, which is no one. So if we don't have a healthcare facility, I think no one will be getting healthcare, either community or the healthcare facility itself. So they are literally the first and last line of defense. I hope I didn't put too much into one session. The tools are all available. We'll be sharing links and all available on WHO websites. And as I mentioned, don't take them as them. Take them, change whatever you feel is relevant to you. Adapt them into your own context. Apply whatever you feel is needed for you and priority for you, and eventually the main goal would be the same. So apologies for talking too much, and we'll be handing back to Yiqi. Thank you.
Thank you so much, Saleh. Yeah, it's always great to hear you present. You're such a great presenter, very engaging, and I think that made us all very motivated to start our journey on climate resilient, environmentally sustainable healthcare facilities ourselves. And I think the last point you made, that it is necessary to look at the guidance, but also adapt it to the country context and the context we live in. This is very crucial. And I think this is also an amazing bridge to now the next point on our agenda, which is we will have country representatives talking about their experience in the country embarking on this journey. And I would like to kindly hand over to, sorry, I have to peek here, Dr. Abbas Shahsavani from the Ministry of Health and Medical Education from Iran. So Dr. Abbas, I hope you are able to share your screen. Wonderful, perfect. Okay, then I'll hand over to you. Thank you. Dr. Abbas, just a note that you are still muted. Not sure whether, yes, now.
Okay.
Yes, yes. Now I can hear you. Great.
Hello, everyone. I'm Dr. Shahsavani from Ministry of Health and Medical Education. First of all, I would like to express my deepest gratitude to my college at the EMRO and representative from the Islamic Republic of Iran. The Ministry of Health and Medical Education has implemented a strategic approach, Science 2019, to address climate change and health. This approach encompasses the following three sections: vulnerability and adaptation, climate, and health. In the context of vulnerability assessment, we first analyze the current situation. Subsequently, we assess the potential consequence based on IPC scenario, and finally formulated actionable strategy. About climate resilience of health system, we began by evaluating the climate resilience and environmental sustainability of a special health center across 6 regions in Iran with different climate status. Following this assessment, we developed an actionable strategy, and we done a project on water sanitation and hygiene and waste management. Further initiative by Iranian Ministry of Health comprise develop a joint Manh and WHO 5-year strategic framework of action on environmental and occupational health subject with a special focus on climate change and health. And building capacity for estimating and evaluating carbon footprint in selected healthcare facility with Abbas tools, and calculated carbon footprint in 60 hospitals in all of Iran. And other activity, Iran creating a comprehensive document to strengthen Iran's health system resilience and promote its environmental sustainability in the face of climate change impact. Other activity is innovative and evidence-based solution toolbox for improving climate resilience, environmental sustainability, wash and waste management. The political commitment of Ministry of Health and Medical Education of Iran regarding climate change include the following COP26 health program. Manh of Iran officially committed to build a climate resilient and environmental sustainable health system, and Iran will remain committed to this until 2035. Also, Iran is among the countries endorsed the Health and Climate Declaration for Health Ministerial meeting at COP28. Iran has set an ambitious goal to achieve net zero carbon emission in its health system by 2060. As you know, Iran is situated in the Middle East and face significant vulnerability to climate change due to 80% of Iran is arid and semi-arid. Iran experienced 1/3 of the global average rainfall and 3 times the global average evaporation, 3 times of the global per capita average the desert area, 7.5 million hectares of desert hotspot, and high frequency of extreme weather events such as flood, drought, especially sand and dust storm, and forest fire. In relation to the commitment of Islamic Republic of Iran to improve the climate resilient of healthcare facility, we collaborate on a joint project with representative office of WHO in Iran and EMRO. The project objective was to evaluate the climate resilience and environmental sustainability to healthcare facility in 6 regions of Iran. In this project, 267 health care facilities were selected, including 48 hospitals, 65 health house, and 69 rural, 50 urban, and 35 rural and urban health center. To collect the data, we utilized the tool provided by WHO. After translating it into Persian language and localized the checklist, we removed some irrelevant questions and used this guideline. According to the tool, information was collected at 3 levels: low, medium, and high performance. And finally, data analysis was performed by using TOPSIS and entropy. As you know, according to the WHO guideline, climate resilience data for healthcare facility are collected in 4 areas: health workforce, water sanitation, energy, infrastructure, technology, and products, and each category is subdivided into 3 subgroups. This is a result of this project. As you see, in the category of health workforce, the investigated centers had a lowest status in terms of human resources, and they had a better status in terms of communication and awareness. The other result in the water and sanitation category, the surveyed center exhibit the lowest compliance with health and safety regulation, while their performance in monitoring and assessment was comparatively better. About energy category, the investigated center had the lowest status in the term of health and safety regulation, and they had a better status in term of monitoring and assessment. In the category of energy of the surveyed hospital, 55% were resilient in terms of monitoring and assessment subgroup, and health house were in better condition than other center in terms of risk management subgroup. In the infrastructure, technology, and product category, the investigated centers were in better condition than other subgroup, as evident from the assessment within the infrastructure, technology, and product category. The investigated center exhibit better condition compared to other subgroup. The final result, 71% of the investigated center exhibit low performance in terms of energy, with only 12% achieving the highest performance. Additionally, 48% of investigated center had the weakest performance in terms of health workforce. 51% of the investigated center exhibit poor performance in terms of water, sanitation, chemical, and healthcare waste. Additionally, 57% of the investigated healthcare facility had the weakest performance in the infrastructure, technology, and product category. If we want to rank the examined healthcare facility in terms of all 4 subgroups, hospital hold the highest rank, while urban health centers occupy the lowest rank in selected healthcare facilities. The results of a comprehensive analysis of the main indicator in the first phase of my project in the healthcare facility shown that the status of energy, infrastructure, technology and product, and water, sanitation and healthcare waste management area was in the low performance, while the health workforce area was in the medium performance. The result of a second phase led to the formulation of 10 key strategy and 43 practical intervention for improving the level of climate resilience, environmental sustainability in healthcare facility. Thank you for your attention.
Thank you so much, Dr. Shahsavani, for this very clear and engaging presentation. I think the slides you showed very well how to optimally use the guidance to have the data that will inform you for further measures. And I think that was very good to show the participants how one can embark on this journey. So thanks so much. Then we would have a next country example from Vietnam, and I have the pleasure to welcome Dr. Lo Man Nguyen from the Ministry of Health Vietnam to give his presentation. And he is the Deputy Head of Environmental and Community Health from the Vietnam Health Environmental Management Agency of the Ministry of Health. So welcome, and over to you. And Dr. Nguyen, if you can show it in the presentation mode, that would be great.
Good afternoon, everyone. So can you see my presentation?
Yes.
Thank you, Professor. Okay, so thank you on behalf of WHO and VIHEMA team on environmental health. Now we would like to present our experience on building modern for climate, water sanitation and hygiene, resilient in healthcare facility in Vietnam. So as you can see, Vietnam is a tropical country located in Southeast Asia. And like many countries, so Vietnam is facing with many challenges on climate change and extreme weather scheme. And you can see in the maps, Vietnam has a very long coastline and river delta region. So we are exposing to several climate related hazards. For example, heat or drought, saline intrusion, or storm, flooding, landslide, and also pollution, air pollution. You can see this slide shows some key negative impact of climate change to our health system. So many scientific evidence conducted in Vietnam show the health effects of climate change, and climate change can be direct effects, for example, some drowning or injury or heat-related illnesses, and also indirect, for example, waterborne disease or communicable disease, waterborne disease, food poisoning, and other communicable disease. And on the other hand, you can see climate change and natural disaster can, for example, storm or flood can damage our healthcare facility, infrastructure, and also interrupt the asset of healthcare service, especially in rural or remote area. So, in 2010, WHO support, we came up with initiative to build a modern on climate change, resilient, and environmental sustainable in healthcare facility in order to promote climate resilient and low carbon emission in healthcare facility. And this slide shows the reason why we propose the modern. You can see in Vietnam, there are many old healthcare facilities which are very vulnerable to climate change because they are not well designed or adapted to climate change hazards. So on the other hand, our government also committed to reach net zero carbon emission. So reduction of carbon emission in healthcare facility is really needed in our country. And we also consider that the good model for climate resilience in healthcare facility is starting point for building a climate resilient healthcare system, and make WHO framework for climate resilience on climate change in healthcare facility is realistic in practice. At the beginning of the project, we followed WHO guideline, WHO framework on to develop the project proposal, and our project proposal include 4 key components. The first one is health workforce or training capacity, and the second one is improve promotion of water sanitation and hygiene, and also healthcare waste management in healthcare facility. And the next component is energy, especially we focus on efficiency, energy usage, and green energy. And the last one is infrastructure. We focus on technology and product on how we can provide safe water supply, how we can ensure the green energy in healthcare facility. So now in 2000, you can see from pilot the model, we would like to draw the lesson, learn and develop guideline and policy for scaling up. Good lesson to entice the country to get the high gas coverage of healthcare facility that can which are able to cope with climate change, and this is how we implement the project. We in 2021 we select 3 healthcare district hospital, which represent for 3 typical climate regions. One in Mekong River Delta, which affected by sea level rise and zone water intrusion, and the second one in the center region, which affected by drought, and the last one in the north of Vietnam, which were affected by storm and flood. And then during 2022 and 23, we conduct several activities in accordance with WHO guidelines, and we provide a lot of training for hospital staff on climate change and health, on how to implement WASPs, or how to energy efficiency or rich communication, and also how to develop the action plan for climate change action plan in healthcare facility. And with WHO supports 3 different water treatment systems were provided in 3 pilot hospitals. And one system is for removing zone in water, and one system for treating surface water, and the last one is for harvesting rainwater. So and we also provide in together with safe water supply. We also conducted regular water testing and water monitoring to make sure the quality of water, and also make sure the efficiency of operation and maintenance of the system. And we also mobilize the support from Habitat to provide many mobile hand washing facilities in pilot hospital. And the hospital also paid some small investment by themselves to upgrade and maintain the toilet facility in the hospital. And we also support the healthcare facility to develop action plan on climate change adaptation and mitigation to improve the water sanitation and hygiene service, and also energy efficiency in for the further implementation. And in terms of mitigation, this year with WHO support, we are conducting carbon emission inventory in healthcare facility, and now we are working on how to develop the methodology and tool for carbon emission assessment. And you can see this photo, this picture. So Yên Thành Hospital, we installed surface water treatment system to cope with water shortage. The hospital is located in very far from other available local water supplies, and underground water is not available, and rainfall is also limited. So surface water treatment system is only option to the hospital. And you can see here is Yên Thành Hospital. We sorry, this is the hospital in the Mekong River Delta, and in this place there are more water, but in the drought season the water is shortage, and also water is salted by saline infusion. So medical staff always have to bring the water from home to the hospital for their activity. So no water available here, and that's why we install the desalination system for the hospital to make sure the water supply. And here is the rainwater harvesting in Bảo Nhai Hospital in the northwest of Vietnam, and the situation is very different with other region with surface water and underground water. So, but the rainfall is very high, so that's why we apply this model for the hospital. And last year, WHO also conducted quick investigation and evaluation on our pilot model, and this is some initiative achievement we learned from the project. The first, we found that awareness and capacity of both management board, leader, and staff also increased, and now they understand more about the importance of climate change intervention to the hospital, and they also developed the action plan to adapt with climate change in the facility. So I think this is very important point. And we also found that water supply, sanitation, and hygiene in healthcare facility also improved a lot, and to ensure the medical service, even in when several climate conditions, and also in we can see. So, but we found some challenge when implementing the project. During implementation, we didn't pay any investment for green energy because limitation of budget, and we also hope in the near future we can mobilize support from private sector and other stakeholders for green energy application in hospitals. And on the other hand, scaling up the modern to other hospitals is very challenging, because in Vietnam we have a big number of healthcare facilities, so, and also because we have challenge on limitation of budget, so this is really challenge for us. And we have a lot of work to do so far, so we will try our best to maintain and complete the modern and then we can share the good lesson learned from the modern in order to scaling up the modern to other hospital and can be applied nationwide. So this is some our briefing on our project. So thank you very much for the attention.
Thank you, Dr. Nguyen, for this presentation. I think it showed again that Vietnam is such a leader in climate resilient and environmentally sustainable healthcare facilities, and also in climate change and house in general. And thanks so much for sharing your experiences and also the challenges, because I think this is always something that other countries also can learn from. And also very impressed with the pictures you've shown and that graph with the rainwater treatment. Yeah, and we already mentioned that, but just for information to everyone, we're gonna share the slides and also the recording for everyone's reference later on our website. Thank you. Yeah, we're very good on time, and we're moving to our next point on the agenda, which is the group work. My colleague Christina is gonna open the breakout rooms in a minute. And just to note, so those who have already visited one of our webinars is probably familiar with that. So we're gonna have smaller breakout rooms. The topic we're gonna be discussing is the same in every breakout room. This is why you will be randomly assigned. But please note that we will only have interpretation in the main room. So if you require interpretation, when on your screen it pops up that now you're going to be assigned to a breakout room, you can click not now. So you can stay then in the main room. We will have Jamboards to facilitate kind of an interactive discussion, but more will be elaborated in the breakout rooms by the facilitators. And this also as a reminder to the interpreters that when this pops up on your screen, that you also kindly press not now so you can stay in the main room. So with that, yes, we can now see. So I'll see you on the other side. Okay, I think we're slowly all coming back to the main room. Thank you so much for the engaging discussion in the breakout rooms. And yeah, I'll hand over to Saleh to moderate kind of some quick summary points. Thank you.
Thank you so much, Yiqi. I think very interesting inputs from all. I think also I believe that this is a very big or wide topic of discussion. So many things could be added, I think, at a later stage. But Anish, a good idea would be great. And before reporting back from my own breakout room, I think I will go to Amy to report back from room 2.
Thanks so much, Saleh. We had some good discussion, although quite short. And there's quite a lot on our Jamboard, which we will share after the webinar on the webpage. I think one of the things we discussed the most was that one of the challenges some of the users have found with the tool is that it's quite long and there's a lot of checklists. So we had some discussion around how to prioritize which checklists are the most relevant for a country, and not necessarily having to go through all of the pages of checklists. So that's something to consider, adapting the guidance to local context. And there was another question around adapting it to national context. And as an example, Fiji has adapted the WHO guidance to their national context, which is also an option. And one question we had that we didn't quite get to, but would be interesting at some point to think about, is how to ensure sense of ownership of the work on climate resilient, environmentally sustainable healthcare facilities. And then we have quite a few more comments on the Jamboards, but we can share those and we'll move on to the other groups. Thanks, Saleh.
Thank you, Amy. I think similar also points were raised, I believe, in the breakout room where I was, and very interesting points. Maybe we'll be moving to breakout room 1. I think Joshua will be reporting back.
Yes, thank you so much. And just like the other colleague has shared, our breakout room also had a lot of information that people shared. But I think what came out boldly as well is the parameters are quite many. And at a country level, it is kind of hard to, to agree with the ministry on now that, we are going to work with these few for these facilities, but also there was the element of need for a lot of finances are required and commitment from the ministries, but interesting in terms of the solutions and the way forward. There is need to work as well with different other private sector players, to kind of work together with other different players, and also to make sure we work with the communities as well, so close, and then maybe finally to do a lot of capacity building for the different health workers as well. Yes, so there are a couple of them, but I just could probably highlight those few. Thank you.
Thank you so much. That's very precise and I think useful points, and it all makes sense together that common points appearing in different discussions. I think it's very logical, and that is expected, and a good indicator. So moving maybe to breakout room 3, our colleague Vimal.
Thank you, Saleh. So our group discussed the experience in basically using the climate resilient and environmentally sustainable health facilities and barriers and enablers. Just looking at the barriers, I think the discussion point was largely to do with finance and budget. There was a discussion around the pressure on the health workforce to actually drive this, the lack of awareness to other stakeholders, and it became a very health-centric approach. Somewhat a lack of institutional capacity, again, goes to HR issues. Discussion of around lack of data or evidence around it, and sometimes some of the participants had reported that support or the buy-in at the executive level. Just very quickly looking at the enablers, or at least how do we overcome these barriers, basically through drafting of policy, looking at political buy-in. The political will is very important. Looking at stakeholder engagement, looking at building on literature, looking at research publications, looking at best practices, building on alignment to national policies, and looking at the greater climate change agenda. And there was quite an extensive discussion on core benefits. So really important to look at what other sort of sections other non-health sector partners are doing that will benefit health. We were not able to get to the last question. There was quite a lot of discussions on this. So that's just a quick summary from our end. Thank you.
Thank you so much, Vimal. And I think yes, we can use more time also at any stage. And I think I've nothing also to add from our breakout room, since all the breakout rooms were very similar discussion points or inputs. Same were going at the main room that I was in, the breakout room, the main room. Different challenges or discussions about capacities, awareness, commitment, the budgeting and the finance, the need of coordination, and the sense of ownership of the issue. These could be, let's say, overcome by capacity building, having more finance, having more commitment and advocacy on the level engagement of different stakeholders. Building and developing investment case studies to show the benefits of implementing these barriers, and I think main points around the interventions were to have some sort of appreciation or incentive to the healthcare facilities and workers that are advancing the actions and practices of sustainability and resilience, and building more and easy ways to access finance, and trying to put the issue of the healthcare facility into the overall national adaptation plan. So very glad with the discussion, and the points all valid, and I think more and more can come in the future with different discussion, and I hope it was useful to all and interesting before that. So thank you all for the breakout room. So we'll hand back to Yiqi.
Thanks, Saleh. Thank you everyone for participating in our webinar. We're already 2 minutes after 11. So I just quickly posted the web link into the chat. For those who are interested in visiting further webinars, you are very welcome to join us again and register. And we also have a session in the afternoon with the same content, but different country experiences. So thanks again, and see you next time. Bye.